Start today with an update on hospitalization rates and ventilator data. I want to remind everyone interested that all of this data is available, including regional breakdowns, on the Illinois Department of Public Health website at dph.illinois.gov, where it's updated daily. First, our hospitalization data. To remind you, this is a count of the number of COVID patients and assumed COVID patients in the hospital in any condition, whether mild or serious. So here's the time progression so that you can get a feel for the direction that things seem to be going. On April 6th, we had 3,680 patients. On April 10th, that number had risen to 4,020. On April 14th, that number had risen to 4,283. And as of April 19th, we had 4,599 Illinoisans in the hospital with COVID-19. That's a net increase of 316 from April 14th. For context, early modeling in mid-March showed that without social distancing, we would have exceeded our hospital capacity by more than 25,000 beds by April 6th. And to be clear, we are still seeing too many Illinoisans hospitalized with this virus. But because Illinoisans have come together by social distancing, learning at home, and staying at home, we've so far prevented our worst-case scenarios. As you can imagine, when fewer people are contracting COVID-19, not only are there fewer hospitalizations, but also fewer ICU beds and fewer ventilators needed. I'll offer the same time series progression to you for our COVID-occupied ICU beds as I did for overall hospitalization rates. On April 6th, COVID patients occupied 43% of our 2,700 ICU beds. On April 10th, that number was 40% of 2,900 ICU beds. Remember, our institutions have worked to expand their bed capacity, which is why our overall bed number keeps increasing. On April 14th, COVID patients occupied 40% of the nearly 3,000 ICU beds. And that brings us to today. Of the 4,599 Illinoisans in the hospital with COVID-19 right now, 1,239 of them are in the ICU, occupying 40% of our now 3,100 beds. Another critical metric to watch is the number of Illinoisans with COVID-19 who are on ventilators. Of the 4,599 Illinoisans in the hospital now, 757 are on ventilators. That means 23% of our total ventilator inventory is currently in use by COVID-19 patients, continuing a downward trend from 25% on April 14th, 27% on April 10th, and 29% on April 6th. And I'll add that 23% of our total ventilator supply is about 10 percentage points lower than it would have been had Illinois not acquired about 1,000 ventilators since March 23rd, when we had about 2,200 ventilators statewide. Today, we're up to 3,200 ventilators. And again, had we not established mitigation measures, by now we would have needed thousands more ventilators beyond our existing capacity. So real progress has been made. And while we never know the exact impacts of the efforts all of you have made to protect your communities, all the projections indicate that you have saved thousands of lives. But as you've seen, our case numbers and our hospitalizations are still rising, even if that rise is slower now. Our curve is bending the right way. With the current mitigation strategies in place, we may not have reached our peak yet, but your actions are helping to keep that peak as low as possible. Also today, I want to discuss the terrible toll that COVID-19 has taken on our seniors, specifically at long-term care facilities and nursing homes, and to review some of the steps that my administration has taken to monitor and protect our long-term care facilities and nursing homes around the state, a priority since the earliest days of our state's COVID-19 response. On February 28th, in my first public update dedicated specifically to the coronavirus, I highlighted that the data from other countries clearly showed that COVID-19 tends to cause more serious illness in elderly populations. And on March 4th, 5 days before we initiated our disaster proclamation, we established guidelines to maximize preparations at our nursing homes, veterans homes, and long-term care facilities. Long before the first nursing home case appeared in Illinois, the state implemented strict measures around restricting visitors at the long-term care facilities that we operate, such as the veterans homes and DHS facilities. And we collaborated with industry associations to have the facilities that we regulate implement similar strict guidelines. We also instructed local county and city health departments on best practices and protocols for PPE usage, heightened hygiene practices, contact tracing, and family notification. And we have provided that training continuously since then. The week of our disaster proclamation, we began regular communication with all of our long-term care facilities, their governing organizations, and local health departments to provide educational instruction and answer questions. Between our educational webinars and regular calls, formal communication among these organizations and IDPH now takes place 4 days a week, with additional one-on-one discussions happening around the clock to troubleshoot issues as they may arise. On Saturday, March 14th, the first nursing home case was announced at a private facility in DuPage County. The Illinois Department of Public Health immediately sent a team of infectious disease experts to ensure proper protocols were being followed and ensure that communications procedures with residents, family members, and staff were implemented internally. When there's an outbreak at a long-term care facility, there's so much to do all at once, and the expertise doesn't always exist on the ground at these homes every day. So IDPH began to see that the most effective way to respond to an outbreak was to have a strike team of experts and advisors immediately make people and resources from the department available to double and triple check that training and guidelines were being followed. These experts have been deployed to a number of facilities since that time. The strike teams deployed have more recently evolved to include infectious disease control experts from the University of Illinois at Chicago and volunteers from Project Hope. IDPH also regularly consults with local county and city health departments who can then be deployed to facilities in their regions as well. The best funded and largest local public health departments, like the Chicago DPH, often deploy their own strike teams and ask IDPH to stand down. Beyond a lockdown, experts and guidance, another extremely important component of limiting infections at these facilities is PPE. A single confirmed case in a facility activates our guidance that all staff in the facility should wear formal PPE and all residents should wear masks. IEMA provides these supplies from our state inventory to local health departments to provide long-term care facilities with all necessary PPE beyond what they may stock and procure on their own. The state has now provided PPE to all 102 counties and made clear to local health departments that when it comes to distribution, the long-term care facilities are priority recipients alongside healthcare workers and first responders. Long-term care facilities that run low on PPE contact their local health department who provide it, and they in turn can get replenished by the state. As you know, we are continually scouring the global PPE supply chain and making acquisitions so that we can fulfill these requests as quickly as possible. I also want to talk about COVID-19 testing at long-term care facilities. First, it's important to note that once a nursing home has a confirmed case, we treat any additional symptomatic residents or staff as if they are a confirmed case. Formal testing has had nothing to do with whether a nursing home resident suspected to have COVID-19 can receive care for COVID-19. As for staff, long-term care facility workers are considered healthcare workers, which means they've long been able to access testing at our drive-through sites and other hospital locations that prioritized healthcare workers and first responders. As swabs and VTM availability increases in our state, we're now able to more aggressively deploy testing at our long-term facilities. We're implementing a two-pronged approach to this work. First, let's discuss facilities without known COVID-19 outbreaks. We're working to test all residents and all staff at those homes. We're prioritizing testing at long-term care facilities that are home to our populations where a COVID infection is more likely to lead to higher severity cases, especially among Black and brown communities. This testing at non-COVID facilities will allow us to identify early the presence of COVID-19 in a facility and isolate those cases before widespread transmission. With support from the Illinois National Guard and the Illinois Department of Transportation, our teams delivered tests to our first 2 homes over the weekend, and will do the same for an additional 10 facilities today, with more to come. Second, in facilities with known COVID-19 cases, we continue to operate under the assumption that a resident displaying symptoms of COVID-19 has COVID-19 and should be isolated accordingly and receive the appropriate care. One change, however, is that we've altered our protocol related to staff. Where in prior weeks we've advised that staff be given pre-shift wellness checks, including taking temperatures, we will now be ramping up testing on all staff who work at these facilities, all staff, allowing us to determine who is coming in and out of an infected home, possibly asymptomatic, and should instead be at home in isolation. This will be critical to our work to prevent further spread at these facilities. I briefly want to address concerns about long-term care facilities not adhering to proper COVID-19 response protocols. Thus far, facilities seem to have been responsive to IDPH guidance and compliant with IDPH teams on the ground. Just like our other healthcare workers, staff at these facilities are frontline workers, dedicating their days and nights to caring for seniors and doing all that they can to ensure a safe and healthy home for their residents. We, as a state, are deeply grateful for their service. That said, we will not hesitate to hold any bad actors at the management level accountable. These private facilities are home to some of our most vulnerable Illinoisans, and we expect owners and managers responsible for their care to take every action at their disposal to keep them safe. Finally, I want to make sure that our long-term care residents and their loved ones know that our statewide data about COVID-19 in nursing homes is available on the Illinois Department of Public Health website at dph.illinois.gov. Here you can find information about which nursing homes and other residential facilities around the state have a known presence of COVID-19, and we will continue to provide as much information as possible.